Hi, I'm Dr. Henele, and I'm here to talk with you a little bit about release point therapy, one of our assessments. It's called an emotional charge assessment, and it's a way for us to really get a quick, immediate sense of where a person's nervous system is at. People go through a lot. People go through a lot of negative experiences, and they have a tendency to accumulate on the nervous system. And we found is in reviewing the body, there are certain places where the nervous system will actually hold a lot of tension in the form of what we call emotional charge, and that it has a lot to do with a sense of being ticklish, believe it or not. What we do is we go through an emotional charge assessment, and it gives us a feeling of, is this nervous system going to be able to get into a parasympathetic mode easily, and to what extent are we going to be able to help them in their healing process? Because all healing really originates on a physical body at the root of the nervous system. So what I want you to do is come on in a little bit. We're going to talk about some of these points pretty briefly, but I want to demo one of these things. So, in emotional charge assessment, there are a few points that we check out. One is on the gallbladder meridian here, just below the ASIS on either side, and it's going to be indicative of kind of where the rectus femoris inserts at the AIIS. So we're going to go in and cross fiber in there gently. The next place that we check is we run our hands a little bit over the abdomen, and sometimes when you do that, people's abdomens will flutter. That tells us that there's charge that's kind of keeping tension in the digestive tract. The next place we go to is right in here, in between in the intercostal space of the ribs, and we can see there's probably a little charge there because we're getting a little bit of smile and ticklishness already. And this is a liver point, liver 13, liver 14. This is going to tell us a lot about, is there any frustration going on in this person's life? The next place we come up to are lung points, lung 1, lung 2, across the pectoralis minor. And in doing so, we get to see, is there any long-standing grief or whatnot. Last place we check on the front of the body is CV17, which is a heart point. And sometimes what will happen is you'll go and touch this point and you'll see a person's face just change and crunch up, and it tells you, okay, that obviously didn't tickle, but if I press this lightly into someone's tissue and the pain is that intense, it tells us that there's a lot of emotion associated with the heart. So let's look at this. In reviewing these areas, the hips have a lot to do with creativity. The stomach has a lot to do with how we're absorbing and processing life. The rib cage here has a lot to do with frustration, impatience, anger, more liver kind of energy. The lung point has a lot to do with grief or internalized emotion, internalized sadness. And the CV17 in the middle has a lot to do with heart pain. And that's what you see in a lot of people who've lost a loved one or been through a bad breakup. The heart will just be very, very sensitive and very painful. Reason being is that the first thing we feel once we go through a breakup isn't hate or fear or sadness, it's hurt. And that's something that you have to understand about the body and its healing process, but that's a topic for another day. So, one of the things we want to do is find the ASIS, come in with our hand, palpate it. We want to work across the body in this case because we want to work across the energy field, almost taking a person out of their comfort zone. Mark your point here a little bit. We're going to find the medial side of the rectus femoris muscle, and then we cross fiber. Now, we're getting a little smile up there, but we're not getting any twitching or any retraction of the body. You'll know there's emotional charge in the body if the muscles retract. That's the key ingredient. If a muscle retracts, then there's charge on the nervous system. We'll explain that more in books and in classes and stuff like that. We come up from this point. We've done that. We didn't really get in there. I'd say that's maybe a 1 out of 10 because we got a facial change, but we didn't get any twitch. There's no real flutter here, so that feels good, although the abdomen does feel a little tight, and I can feel an abdominal pulse that tells me there's a little tension in the digestive tract, especially around the small intestine. We come up here to the intercostal space, and when we cross fiber, we see that there is a retraction, there's a shift in the body. Go ahead and draw out a little bit. We see that when we do this, you see how the body is shifting. The body's coming up, the leg is shifting. What that tells us is there's charge, and it's associated with liver energy, so there's some element of frustration going on in this person's life. We come up here, Nothing in the lungs at all. I mean, you can't feel any tension in the muscles. There's no twitch or retraction. There's nothing. Let's go ahead and check the heart. Nothing. And you notice when I press in, I'm not pressing in deep or hard. It's just a quick stimulation. That's all we're doing. So that's on this side of the body. Highest charge area right here would be in the liver. We got a retraction. We got the body moving. That's probably about a 4 or 5 out of 10. Go ahead and stay right there, and let's go to the other side so you can see it from a different perspective. I come back in. Notice I'm always contacting my client with my other hand. I'm not just leaving this hand off and doing this. I want them to feel comfortable that this is not a judgment. This is an assessment. It's a very key ingredient. This is an assessment. We come in here, find the medial side of the rectus femoris, do a little cross fibering, nothing. Come up here to the other side, little something, but not nearly as much. So it's interesting to see. There's actually more tension and more charge on the left side of the body than on the right side of the body. And that's why you want to check both sides, because you can't assume that they're balanced. A little more tension in the muscles here on the lung point, but still no retraction, no charge. It didn't hurt. We didn't see her face crunching up or shifting up. Come in here, nothing still in the heart. So the biggest assessment we have is a little bit of frustration going on. Now, the front of the body is how the person deals with their world. The back of the body is what's going on between them and their selves. So let's look at this again. The front of the body, the energetics, are dealing with what's going on between the person and their world. So this might be a frustration in a job or relationship or whatever. The back of the body, though, tells us what's going on between them and themselves. So Anita, go ahead and turn over. And we're going to check basically the same areas. We're going to check an area right here, the piriformis. We're going to come into gallbladder 30, and I've gone from the sacrum to the greater trochanter to find the piriformis right there. And I'm going to put just a little bit of elbow pressure because I got to get through it. And what we see, nothing. No charge. There's no immediate retraction of the body. That's great. Come up a little bit. We're going to come into about the level of the liver right here. UB, I think it's 17 or 18. I think it's 18. Find the UB point. Cross fiber. Nothing. This is fantastic. What this tells us is Anita, the frustration is between her and the world. It's not affecting how she sees herself, which is key. We come up here. Check and see if the heart is open, see if the scapula can come off of the rib cage very easily. It can. That's always good. The scapula will typically come in and hold down tight if it needs to protect the heart. So then I'll come back around, we'll do the other side to make sure we're doing the other side properly. Find the sacrum, find the greater trochanter, find the midpoint. That's gallbladder 30, we'll check it. There we go, we got a little bit of a twitch there. That little twitch tells me that's probably about a 3 out of a 10. So there is a little bit of charge on the nervous system in the creativity for Anita between her and herself. Come up a little bit more, and boom, a little bit of tension at the liver level on this side, on the left side. So we know there's a little bit of charge going on, a little bit of frustration, a little bit of creativity issues. So those are probably some energy blocks there that we can expect to open up through the release point work. But look at this, is a beautiful thing. The heart is still wide open. And that's really a major benefit when you're working with someone. Had we only been able to get Anita's arm to here and we couldn't get it up, that would tell us that the scapula is staying glued to the rib cage, and it would tell us that the heart is kind of closed. But in effect, that's our emotional charge assessment. It's something you could probably do in under 2-3 minutes to get a real good feel for how a person's nervous system is going. All right, very good, thank you.